Well, welcome to the short version of Basic Life Support for 2020. My name is Martin Coughlin. I'm the instructor. I work along with Jeannie Klein with the BLS and ACLS. I'm going to give you a short video here and demonstration on some of the things that you're going to need to know for basic life support. First of all, you have to evaluate the patient, see whether if you walked up to them and they're not breathing, you look at them, evaluate to see if they are. You can check the pulse, 5 to 10 seconds worth to see if you can check the carotid pulse. If you find that there's no pulse, you can holler for 911 or holler for help. If there's enough people around, you can ask somebody to find or hunt down a AED to get that in there right away, so you can get the person hooked up to the AED as fast as possible. So, the high quality chest compressions, you're going to hear that a lot within the basic life support. And on this person here, I'm going to place my hands between the nipples on the lower one half of the sternum. That's when you place your arms and get directly over. And I want you to go straight down. The compression rate is 30 to 2 on the adults. If you get a fairly large teenager or a 7-year-old that's 70 kilos, you might have to use the two-hand method versus a smaller 5-year-old where you can use the heel of one hand and the rate is 15 to 2. Now, as to remembering the rate, the best videos I can tell you is a Ken Jung American Heart sponsored video that's on YouTube, and or you can go to the British Heart Foundation and look up Vinnie Jones hands-on CPR. It's great, it'll get you in the mood to remember a good beat to do your compressions to. Now, the compressions down on the adults going to be anywhere from 2 to 2.4. Now, not many people are going to know the difference between 2 and 2.4, but if you're going like this, you're not compressing deep enough, you're not getting any volume distributed. Sometimes the patients get a little too over anxious and they can really push down too hard and end up cracking ribs. Just reevaluate your hand placement, put it back on there, and if you can put it in your head, the Staying Alive song, that'll give you your 30 to 2 compression rate. When it comes to airway, over the last few years, they've taken the concentration and put it up here to do the chest compressions. Lots of times people do not want to mess with the airway. It's very difficult to begin with. For us that in the medical field, you have AMBUs,